Cancer diagnosis often begins when you or your veterinarian feels a lump or suspicious mass on your pet.
When did you first notice that lump?
Well, let's see, it was probably 4 days ago.
To find out if this lump is cancerous, your pet may need to have an aspirate or an incisional biopsy done. Aspiration is when your doctor inserts a needle into the mass and cells are removed for evaluation. In an incisional biopsy, a larger portion of the mass is removed and sent to a lab for analysis. In the lab, a pathologist examines the cells under a microscope.
What we're looking at under the microscope is what's the shape of the cells? Are they in clusters? Are they individual one cells? Even just how they behave and how they stick to each other can vary.
By looking directly at the cells, pathologists can determine if a lump is benign or malignant cancer. This information helps predict the behavior of the tumor and helps in selecting the appropriate treatment options for your pet. When diagnosing cancer, veterinarians also rely on imaging studies and blood work. Blood work shows if your pet's organ functions are affected by cancer and indicate your pet's overall health status.
So we may start with chest x-rays to evaluate for spread to the lung. We will do an abdominal ultrasound to get an initial assessment. And then we do a CT scan, and that allows us to identify where the tumor is in the primary site as well as any spread to regional lymph nodes.
Each of these imaging studies provides a different type of picture of your pet's internal tissues. Sometimes, combinations of these studies are required to gather the most accurate information about the extent of a tumor and whether there is evidence that it has metastasized to other areas of the body. Your veterinarian will evaluate the information obtained from the various tests and imaging studies to make an accurate diagnosis and to determine your pet's treatment options and prognosis.